Oxytocin is this great bonding hormone, but beyond that, it is a hormone of longevity, of immune support, of cognitive brain support, of cardiovascular support. There's so much that we are just finding out about really the far-reaching powers of oxytocin as a neuropeptide hormone.
You are tuned into the Dr. Tina Show with Dr. Tina Moore. For more, visit drtyna.com. On this episode of the Dr. Tina Show, I'm sitting down with my friend, Dr. Anna Cabeca. She joins us today to discuss all things oxytocin and vaginal health. You may know Dr. Anna as the girlfriend doctor. She's a triple board certified and fellow of gynecology and obstetrics, integrative medicine, and anti-aging and regenerative medicine with over 30 years in the space of functional medicine, sexual health, and bioidentical hormone replacement. She's the best-selling author of 3 books, The Hormone Fix, Keto Green 16, and Menopause. Anna and I always have the best time when we chat, and she certainly held nothing back. I think you're really in for a treat on this one, so let's jump in. Dr. Anna, thank you so much for coming on the Dr. Tina Show today. We are friends. This is a great conversation that I'm about to jump in with you, and I'm so glad you're here. You and I are both fans of oxytocin, and you are the expert, and I have been waiting to get you on here to have this conversation. I realized I was supposed to have you on last year, and then I think I got sick or something, and I had to cancel. So this is such a critical, it's part of the signaling peptide hormone orchestra that I love talking about, but I have saved this conversation for you. So we're going to talk about that. We're going to talk about vaginal health. We're going to talk about topicals around the vaginal area and how important it is, and maybe how we have some different thoughts than maybe the going conversation. And we're going to jump into all of it.
Yeah. So oxytocin is actually the most important hormone in our body. I consider it the queen mother of all hormones, because when oxytocin's in balance, everything else falls into order. And so we look at this, like when we think of oxytocin, we want to make sure we're not confusing it with oxycodone, the pain relieving hormone. But oxytocin, many women have received this in childbirth. They receive Pitocin, and that is exogenous oxytocin. That's pharmaceutical oxytocin that we inject to help stimulate labor. And naturally, when we're in labor, we produce oxytocin. It stimulates uterine contraction. It stimulates milk letdown. And it's part of that hormone that when you get through that childbirth, and I know you had a traumatic childbirth experience, but you get through that childbirth experience, all of a sudden, you're like, oh, maybe I can do this whole thing again. Maybe not. But oxytocin is that, you look at this child and you're like, oh my gosh, I am bounded to this child. I will protect this child with my life. And there's a feeling of love that goes beyond anything that you ever experience. The same with oxytocin with a love partner, with sexual stimulation. And you're like, oh my gosh, maybe I really didn't like this guy, but now I had this great orgasm. I could see myself with him. So it can be a little misleading sometimes. But, oxytocin is this great bonding hormone. But beyond that, it is a hormone of longevity, of immune support, of cognitive brain support, of cardiovascular support. There's so much that we are just finding out about really the far-reaching powers of oxytocin as a neuropeptide hormone.
Yes. This is I think of it as the hormone that we get when we get and give hugs, when we cuddle with our children and our loved ones. Like you mentioned, I think this is why sometimes women will bond onto a man that they maybe were just having a fling with, and it was supposed to be some kind of casual fling. And next thing they know, they're feeling serious emotions. That's oxytocin at work. And I, in my practice, was, predominantly regenerative injection therapies and pain. So I used it a lot there for people, just in the realm of pain and trying to calm down the nervous system.
Yeah, because it's a potent analgesic. That's the part of even with childbirth, naturally forget the pains of childbirth. And it's an amnestic too. So between the analgesic and amnestic, you're like, oh yeah. You remember only when you're in the midst of it again or something like that. But that it's a powerful analgesic.
It really works well too. I think that with pain, what's interesting, I have chronic pain and I treated a lot of pain. I mean, that's pretty much what I did for a career. And we're supposed to forget our pain. And sometimes our nervous system gets mixed up and we don't forget our pain, and it's a central sensitization kind of wind up central nervous system phenomenon. And I have found And that's a really terrible place to be, because then you're in a loop, and it's a very difficult loop to break or cycle to break. And I have found oxytocin to be phenomenal for breaking that loop and getting people to a place where it's not that you don't, it's not like an opioid where you don't care about the pain. It's a calming down of the nervous system enough to move through the pain, is how I've tried to explain it to my patients and what I've experienced personally. But can we take too much of it? Because I love it. I love it.
Well, and for FDA regulation purposes, we'll say it's only, exogenous oxytocin is only approved for stimulating labor and delivery right now, but it has so many far-reaching purposes, right? So off-label, we've been using it for sexual function, for pain, for nervous system, and PTSD. And what you're like, the whole concept of what oxytocin does, it's like repaving those ruts and potholes of the roads of our life. It does go a long way to that. And the question, can we use too much of it? This is where I think we can get into some trouble, because it's a power, like if we're making oxytocin, it's just going to feed on itself and you're going to make more and more oxytocin. But if we're getting it exogenously, we may downregulate the receptors long term.
Yes.
So we want to take breaks, and pulsatile use of oxytocin, I think, is the safest way.
Yes, I use it when I need it. I use it to get out of a rut, literally. So that was a great way to describe it. I use it when we have it compounded. This is a prescription item, and it comes in the compounded world. It comes in different various delivery systems. But I actually, just like I do with GLP-1s, I really like to keep everything as low a dose as possible and help patients utilize it, again, only as needed, because like you said, with receptors, we got to cycle things so that we don't, get receptor desensitization. But it really can smooth out those ruts. That's a nice way of putting it. Kind of gets you over the hump, if you will.
And if you add it, like, again, off-label, but like oxytocin nasal spray with some ketamine in it for PTSD, trauma, when you're deep in those ruts, and also for pain, that combination of the two is like, I always describe it as, if you think of skiing on Christmas Day, at the end of the day, there's like all these tracks in the snow, but you look at that first snowfall, that fresh snowfall before anyone gets out there, and it's this lovely coating of snow. And I think that's what definitely oxytocin does, and the combination of oxytocin with ketamine too.
That's a great idea. Yeah, I hadn't considered that. I do find that oxytocin, like I said, it breaks that loop. It breaks that cycle. I just did a podcast that should have come out by the time this is recorded. And it was me talking about the pain trap, is how I refer to it. And I was really stuck in it. I had a pretty aggressive adjustment on my mid-spine, and it lit my I've got some kind of funny wind-up pain phenomenon. It lit my whole spine up, and I was in a bad spot for about a month, and I could not get out. And I was in so much pain that I couldn't think straight. I probably should have reached out to you or any of my friends and asked for, guidance. But I was just, when you're caught in it, you can't breathe and you don't know which way to turn. And I finally caught a breather, and I immediately thought of oxytocin. And so I got my hands on some, and it doesn't take the pain away. It just, and I found this with patients too, it opens a window of, it's like you can finally breathe. And I'm such a fan when folks are in pain, whether it's acute pain or chronic pain, if they can move, if I can get them moving, then we get a window of opportunity. And that usually will start to lead them down the path to feeling better. And I think oxytocin has such a nice impact there. What is it doing in the brain in those cases? Because it almost feels like one of the reasons I love GLP-1s is because it quells neuroinflammation and it gives you some neuroplasticity. Does oxytocin have any capacity like that?
It does the same thing. Yes, it has the capacity to do the same thing. And again, I always think in the best pharmacy in the world, that is our own body. When we can produce oxytocin the best way, one of the things and it's hard when you're in those deep, dark pits of despair and pain and emotional and/or physical pain to tap into that. But there are powerful ways we can do that too. And I think remembering that there's always one next right step that we can take to lift ourselves up, or I like to say, pull ourselves up by our bootstraps.
Yes. So what are some of those ways? Because I have a whole list of them, but I want to hear your list too.
Give them all was, my whole experience with oxytocin, and actually the oxytocin cortisol conversation. Like when cortisol goes up, oxytocin goes down. When cortisol is up for a long time, it signals the paraventricular nucleus to suppress cortisol. It's not that your adrenals fatigue, but it's a suppression of cortisol. But you're in this dangerous place physiologically where cortisol is low and oxytocin's low at the same time. And that's the physiology of disconnect. Physiology of burnout, say I have burnout. Physiology of you go into a restaurant, you see a longtime friend, but you pretend you don't see them. Like no one sees me, I see no one. Isolating, right? Yeah, no more trips to the grocery store during high traffic hours. That's it. Let me Instacart instead. And
so that's low oxytocin and low cortisol
typically
comboed.
that is, yeah, I think it's physiology of divorce, physiology of depression. There's a lot that comes into this. And so when we're in those, and I learned from my own PTSD experience and that sense, like I love my husband, but I don't feel love for him. I love my work. I don't feel like going in to the office again. That complete burnout in many aspects of life. And so as I started working on, this like awareness of this and started to work on increasing my own oxytocin. For me, it was going for walks on the beach. It was prayer and meditation and journaling. It was, really deepening my spiritual awareness and growth and things that I enjoy doing. And that with nutrition, addressing lifestyle. I mean, it's never just a one size fits all, but that with these other components really made a physiologic difference. So then I was like, okay, I can work out. I can, I can focus more. Like brain and cognition just lit up for me at that point. And so the different ways we can do it, like I talk to my patients about this all the time. Like, what are you doing for fun? What do you love to do that makes you happy? Do you have a pet? Because pets are a great way to increase oxytocin. Do you garden? Do you photo? I think I had a patient yesterday in my office. She's 72 and she just had a surgery for kidney cancer, and she's getting to the gym, but she can't. She's like struggling through her day, very depressed. So what do you enjoy doing that you haven't been doing for a while? And she loves photography. Like, can you get behind the lens? Can you do something like that? And that can make a huge difference. For one of my patients, it was her starting up dance lessons again. I mean, I fixed her like hormones, nutrition, detox, all these things that we do. But the thing that moved the needle for her was beginning dance lessons. And so like, things that you enjoy, and I sometimes will prescribe My Big Fat Greek Wedding. That movie is an oxytocin surging movie.
Mamma Mia too. I think Mamma Mia is a good one.
Yeah, absolutely. Absolutely.
Is this why people love going, like, is this why girls love getting together with other girls, like having girls time? I feel like women gathering together is another oxytocin booster.
It is. It absolutely is. And you think about the characteristics of the blue zones or the areas where we have the longest living populations, things that are characteristic of high oxytocin are characteristic within those communities, like having a faith-based practice, having longstanding marriages, having great family relationships or multi-generational households, getting out in nature, good community. All of those things help increase oxytocin. And, like, okay, well, what is it? Is it the getting out in nature? It's a combination of the things that I think, when we win, when oxytocin's winning, that improves our physiology top down.
So if we can elevate oxytocin, we should naturally get our cortisol to decline then. So we can use it as a lever.
We can use it as a lever, 100%. Like I've worked on this area now since my own my PTSD, which began in 2006. And so I've worked on this and this concept and with patients, whether, again, it's always lifestyle, nutrition, we're doing with hormones, and then how do we increase oxytocin naturally? And then if we need it exogenously, when are we adding it and for how long? But these things all, it works as a lever. And if we think so much of our even post-pandemic stress or during the pandemic stress, the isolation, that is that will level your cortisol. And then plus being inside and, flattening out or disrupting your circadian rhythm like we're doing with blue light and and EMF exposures. And so all of those things interrupt our circadian rhythm. And we talk a lot about stress management. I don't know about you, Tina, but when I hear stress management, I get stressed. Like my physiology stresses out just thinking of stress management. But if we think about play, and I like to say microdose oxytocin throughout your day with oxyplay. So just ways to, bump up your oxytocin. Like we talk about 5-minute exercise snacks. What about 5-minute play snacks? And that really does move the needle. And we're going to work on supplements, nutrition, all that circadian reset, sunrises, sunsets, but things we can do to increase oxytocin move the needle the fastest. And people feel it, and their physiology shows inflammatory markers go down. It's powerful.
You can load up a miserable person with all the supplements and hormones and peptides in the world, and nothing will shift.
So true.
And if you can get some, and sometimes we do have to use exogenous oxytocin to get the ball rolling, but it's like a misery cluster. I get in it too. I get in my dark doldrums. And I was at a wedding the other day and pain is exhausting. It just sucks the joy right out of you. And I'm at my stepson's wedding the other day, and I was totally in that place that you described. Like, I don't want to be seen. I don't want to talk to anyone. I'm in here. I get social anxiety anyway. So here I am with all these strangers, and they're the most wonderful people too. I could not ask for a better group of people to be around. And yet here I am feeling like, ee. And finally, I don't know, a song broke out. I started dancing, and I just let go. And I was just dancing, and my husband grabbed me. I'm going to cry. He was like, "This is called fun." Do you remember this? And I was like, yes. And he spun me around.
On itself.
It does. It feeds forward.
Absolutely. That's oxytocin firsthand. That's the magic, right? It's so good. And when you experience that, there was a study done by Paul Zak looking at oxytocin in different populations, and he studied a wedding party. And his analysis showed that the number one way to increase oxytocin, or the number one person with the highest level of oxytocin, was the bride. I mean, that makes sense. The number two person was the mother of the bride.
I could see that. That was a happy lady that day. Absolutely. And it kind of breaks the dam. And then I try to seek out fun. It's hard. That's one of the reasons I'm moving. We've had this conversation, but I have got to get out of this state, because this state as a whole is been sucked dry of joy and fun. It's not a joyous place. And when I travel to other places that have a much higher level of sun exposure, people are happier, and there's just more joy in the community. And there's the people giving you coffee don't treat you like they hate you. They are happy to give you coffee. They're happy to wait on you and serve you and be good customer service. And it's very different. And you can travel around a place. I think sunlight has got to be a huge player in this too. Exposure.
Yeah. And if you think of it, exactly right. When I've studied cultures around the world, part of my research and looking at hormones and hormonal health, women as we age around the world, and different societies, including some of the most war-ridden societies of the world, and think, okay, well, how are they tapping into their joy? Well, first of all, when you look at northern populations versus southern populations, how does a northern Englander greet you? They're
very, very stern.
Yeah, hi, very stern. But how does a beautiful, Peruvian greet you? Hugs, kisses on both cheeks. It's a hug and a kiss. Well, what creates oxytocin? That hug and the kiss.
Yeah.
So societies that have incorporated that already know, okay, this is a way to build trust, to create relationship, and that's already a high oxytocin moment. But then physiologically, vitamin D is needed for the oxytocin receptors to work.
Yes, there it is.
It is.
Yeah. And I think probably infrared, I'm sure that we'll find out later that the different components of sunlight, just the rays, are going to be a big player too. It's a bonding hormone. And so I can see how in cultures where it's high, those societies probably feel much more bonded overall and much more like a collective than, I think COVID was, that was the first thing I thought of actually when they locked us down. I was in Oregon, which was crazy town for years. I'm still to this day, people are afraid to get near you, and I'm a hugger. So I remember, I think it was like 2021 and I was flying and I was at the airport in Portland and I'm standing next to a guy and I wasn't standing on my circle. And I got too close to him. I was like on my phone, just happy to be going on a trip. You know, I think I was going to Mexico with my husband. So I was like in a good mood. And I got too close to his circle and he freaked out. And I just thought, dude, I just was thinking like, you should just let me hug you right now. You'd feel better.
You're probably right. Yeah.
Plus get a little of my microbiome on him, you know, like share some good, healthy microbiome. He'd feel better. But it really is a killer. I think that's interesting to play into the most recent research. I'm sure you saw they came out with like, of all the longevity movers, strong community was the biggest, component of longevity, period, like the most powerful at the end of the day. So I think it's got to be oxytocin.
It's got to be oxytocin. Austin and David Perlmutter, their most recent book was on that concept of community and how important that is. And that is honestly the building of oxytocin. And then when I looked at these, some of these war-torn areas, what are things that they had in common? They had multi-generational households. They celebrated everything. Birthdays, they celebrated weddings for a week. They celebrate name days, anniversaries. Everyone remembers everyone. Community, like there's big dinners, family dinners together that are just, mandatory, but no one would ever think of not showing up, right? So they build this in the stress. So oxytocin can trump out that stress cortisol, and their dancing and music is part of their lifestyle, and in their language, a lot of gratitude in their language. And I want to, I would say we're creating my own blue zone communities by incorporating these concepts as, oxytocin as a primary focus, like what we can do to play more, have more pleasure. We talk about pleasure deficit disorder. And I was talking with someone recently, Tess Masters, she was interviewing me, and we were talking about, she was talking about masturbation. I was like, well, we don't like to use that word. First of all, masturbation. No, we don't use that word. It's self-pleasuring. And she's like, self-pleasure as a meditation. I love it. And I'm like, oh yeah. Self-pleasure as a meditation, because, that is, we have a deficit, especially when vitamin D is low, stress is high. We think about bringing pleasure into our life, in whatever forms, how that increases oxytocin and really creates a sense of stability. And I will share with you, like in my own experience, so with this caveat, I recently did a 92-hour dark retreat. I wanted to see what, with no hormone, nothing else I took with me. And so just basically in the dark, because in that setting, your body starts to produce more melatonin, which then will convert to DMT. And in that, from high levels of melatonin, we make oxytocin too. So when you see people come out of these dark retreats and they're like, all this compassion, I feel all this love, like in that setting with no disruption, our natural inclination is to make oxytocin, not cortisol. Like you don't come out stressed out of those situations. You come out with, these amazing visions from the DMT, this sense of oxytocin love and this compassion, and that's within us. And I think that's a really powerful experience. Challenge you, Tina.
I know. I immediately got anxiety when you told me you were doing that. I was immediately like, I'm so scared of the dark. Isn't that funny? I have such an issue with the dark. But then I seek it. The older I get, the more I seek it. I think there's a lot to that. I think there's a lot to the fact that we women are driving with cortisol all the time. It is destroying all of our hormones. It is destroying our hormonal milieu overall, because hormones to me are always a finely tuned orchestra, and we're all so different. That's why I'm so just kind of, I don't want to say anti, but this whole like everybody gets estrogen for everyone, on the internet that's happening right now. I love estrogen, and I want to ask you about actually estrogen and oxytocin. I have a note because the two have a very similar impact on me when I take them. But I think that it's the orchestra, right? Like you can throw all the hormones and all the peptides at someone, like I said earlier, and if they are driving with cortisol, which I am guilty of, it destroys your joy. It causes you to isolate. I turn into a hermit. I don't want to talk to anyone. I get, like I said, I get social anxiety. That's all coming from, I know it is, it's all coming from that high cortisol level and those stress levels. And I think that that's to great detriment to us as women. It's really like the opposite of what makes our hormones the happiest. So with that, how does oxytocin play into the rest of our sex hormones?
Yeah, so it's the most powerful hormone of our body. The way I like to give the example, I like to think of like a university setting. Think of all our hormones, estrogen, progesterone, testosterone, DHEA, melatonin, as the students at the university. Each student has their own passion, purpose, roles, skills, right? And so they all have this great, potential. And then you have the professors of the university. I think those as the major regulatory hormones, adrenaline, insulin, and cortisol. And when they're not functioning well, like that professor that comes in hungover or high, turns out the light, the student body's in chaos. So when they're not high functioning or in balance, there's chaos. And then the mother hormone or the dean or president of the university is that oxytocin, that trickle down effect. So as I looked at this and studied this and, I go, well, if I go straight to oxytocin, then it's going to be a lot easier to manage everything else. Right. So certainly we want to balance cortisol and the acidity cortisol creates, cortisol creating that hydrogen ion secretion across the renal tubules of the kidney, creating that acidic urine. Acidic urine for women and men long-term creates bladder irritability, cystitis, urinary tract infections. It can increase potentially incontinence, but we know an acidic urine is associated with cardiometabolic diseases too long-term. So, but it makes sense physiologically because beyond nutrition's a key factor, but I think cortisol plays an even bigger factor in this and, in our overall health. But cortisol being acidifying, oxytocin is alkalinizing. And we think, as an OBGYN in pregnancy, that amniotic fluid has a pH of 8.5. We are birthed in an alkaline environment, right? That is key. And how much does oxytocin play a role in that? I'm not sure, but I look at that oxytocin as alkalinizing. And I studied this, Tina, through now it's 11 years ago when I was 48 and I was having this perimenopausal or second menopause, so to speak, because I'd had early menopause at age 39 and reversed it, naturally conceived my daughter that I was told I'd never be able to have when I was 41. And then at 48 started to be full on in the throes. And I experienced what my patients would come in and say, Dr. Anna, I've gained 5, 10, 20 pounds without doing anything different, right? And as a young doctor, be like, sure, you're not doing anything different. But when it came to me, I wasn't doing anything different. I had gained those 20 pounds. And I was like, okay. So I went strict keto and found out I didn't feel good. I was anxious. I was more irritable with my kids. I called it keto crazy versus keto flu because I knew how to defend against that. But I checked my urine pH and it was as acidic as the pH paper read. This time of my life, I was a single mom with girls in different ages, one in elementary school, a middle school girl, and a teenage high schooler. And there was chaos in my life, but that was such an aha moment for me when I realized basically I was peeing acid. I'm like, no wonder I feel like I'm breaking down. I don't have energy. I have no muscle. I have no focus. So I started in with the alkalinizing foods. And so that's how my keto green or keto alkaline program was born. But I started in with the alkalinizing foods, the bone broth, the minerals, the beet greens, the kale soup, and all that good stuff. But I realized I was checking my urine pH all throughout the day. The mornings I did my, gratitude journaling or my prayer meditation or walked outside or on the beach, my urine pH was more alkaline all day. So that's where I went in to study the renal physiology between cortisol and oxytocin. Like, what was this effect? And it's that seesaw effect until cortisol is too high for too long. And then it's like a broken seesaw. But so that was what really opened my eyes to these shifts in physiology. And then as you increase those, you start creating those oxytocin increasing habits in your life. And my hormones were dialed in the time, but that's why I say it takes more than hormones to fix our hormones. So when we hear these hormone conversations and we want to throw estrogen at everyone, like, whoa, there's a right way and a wrong way to do hormones. And, of course, there's many different forms we can use. So what's the safest form we can use and deliver it the safest way for an individual? But more importantly, think of this hierarchy. When we think oxytocin is the most powerful hormone, Pregnenolone and progesterone are the hormones that decline from age 35 to 55 by 75%. And those are our mother hormones downstream from which we make DHEA, testosterone, and estrogen in that order. So if we start top up with supporting our adrenal glands, so I use a lot of adaptogens, work on that alkalinizing balance. And, I get criticism in this area, but I have now worked with thousands and thousands of clients, have them check, and getting that urine pH, you feel healthier, you feel better, you're really you're in control and you're aware. It's like wearing a continuous glucose monitor. It gives you an idea when your thoughts are creating high glucose versus in the same thing that stress, et cetera, can create acidic urine pH. So you start going beyond what you're putting in your mouth. And I like how you say it's not what you eat, but what you absorb. And that's emotionally too, the energies you absorb around you and the emotional states that you experience. But by shifting that, you really can balance hormones. And I don't like the conversations around medicalizing menopause no more than I like to medicalize puberty or suppress a woman's puberty, because why would we suppress a girl's puberty with birth control pills from an early age of 13? I know it's done quite regularly still, but that is interrupting a normal physiologic transformation, and menopause is a transformation. So we want to do it, we want to do it as healthfully as possible. And every sign or symptom that comes up is a invitation to ask deeper questions, to shift a lifestyle and mindset a little bit more. So then I look at it that way. I go top down with my hormones in that order: adrenal, pregnenolone and progesterone, DHEA, estrogen, testosterone, and estrogen.
Same. That's if you don't address the adrenal glands, and thyroid's in there usually somewhere. If we don't get that handled as a foundation, then the rest of it, people just bonk. That's when I say that on my podcast, you're going to bonk. It's because you're good for about 90 days throwing estrogen cold at someone. But if their adrenals are fried or their thyroid's not functioning, it's no good. It's not good. And I like what you said too about not medicalizing menopause. I think we should dive into this a little bit because I think there's confusion. I give hormones to whatever age person is in front of me based on what they need. So it doesn't matter if they're male, female. I test their hormones. They could be in their 20s. They could be in their 30s. Because you could have a guy in his 20s who has been hit in the head multiple times due to impact sports, and he's got no testosterone, right? So these are important hormones, I think, to get folks. I've always just treated folks to a physiologic symptom relief level. That's more important to me. Yes, I test labs and yes, I track. But what's more important to me is, can I, because my practice was predominantly pain, musculoskeletal pain, regenerative injection therapy. So I was always applying hormones as a way to modify and mitigate symptoms of pain. So if I could ameliorate their migraines or ameliorate their spinal pain, axial pain is very specifically different than extremity pain, and they drive off different highways. And so if I can get their pain to shift in a positive way, then I know we've reached a good titration point in that hormone. And my goal with menopause was always to and where I'm at right now, I'm menstruating regularly, but I still need some hormones. And the goal is just to ease through the transition. If I'm on the other side, I'll probably always take some hormones just because I like the longevity aspect, but I try to keep my hormonal intake as low as humanly possible because I'm just trying to nudge myself, not too low, but what's that sweet spot? And each one of them has a sweet spot. And it's really hard to hit that sweet spot with each one when you are stressed the F out. So
completely,
it's like trying to hit a moving target, even if that person is metabolically optimized, they're doing all the things, they're eating great, they're exercising, they're sleeping, they're having good intercourse with their partners, everything's good, but we still are trying to hit a moving target because cortisol is that spike, I have a tire on my car that just leaks all the time, no matter how much air we put in it. Every time we go to take a long drive, which every drive I live out in the country is a long drive, I'm like, that damn tire, I got to get it fixed. That's the cortisol, right? And so oxytocin, I think you're right. You're 100% right. Seeking joy and trying to find more happy, fun, joyful things in life. And hugs, long hugs. I make my husband hug me for 30 seconds. It can't be shorter. If he hugs me and like goes to do something else, I'm like, no, you must stay. we are,
That's right.
and I try to explain to him, the more that you nurture me, make me feel safe, make me feel beautiful, make me feel happy, the more my hormones will respond positively, and you will get the beautiful, happy wife that you deserve. If you don't, if you say things that are snarky or throw a wrench in the plans or whatever it is, because sometimes he's a little stinker, you're going to get a bitter, pissed off, bitchy woman with terrible hormones. So like, because I think the woman in the family, and this is part of that menopausal shift, I have a point to this, is our transition is really driving how the whole family feels and the health of the whole family and the whole operation.
Oh, completely. And I do want to add in that, you can't fix hormones without fixing your gut. And I like how you always say gut is ground zero. So I want to just put a nail in that, because that's so critical, especially for hormonal health and everything else. But I will say too that, during that time when I was like 48 and like dysfunctional and trying to figure out all this stuff, I remember like my kids were always late to school. Sometimes like we'd be late anyway. So I'm like, okay, let's stop for coffee. I mean, it was really dysfunctional. And then as I got my physiology, as I really empowered oxytocin into my physiology and got keto green, as I like to call it. Like I remember my girls being ready for the bus before the bus was even there, like giving me a smile and a hug before they went out the door. And you as a woman, your physiology changes and your children really receive that. And I've witnessed that in my life over and over again, and in my patients' lives as well, as they got healthier. Like I remember one woman, Kathy, 67 years old. She used to come home from work in the renal lab. She was a dialysis nurse, and she would just be on the couch. And her, beautiful horse was out there for 2 years without being ridden. She was thinking about selling it. She didn't associate with her family. Her family didn't associate with her. But as she shifted her physiology, she wrote me, she goes, Dr. Anna, not only do I love being around my family now and I'm riding my horse again, but my family loves being around me. It's a shift to your entire household. And when they say put your own oxygen mask on first, I mean, this is the real experiential transformation of that.
Yeah, for sure. 100%. If you're the glue, especially if you're the glue, I'm the glue in my family. I'm the glue when I'm not good, nothing's good. And it's like multiple households of people depend on me to be good. And if I'm too stressed out, and it really is, sometimes I have to intervene with exogenous oxytocin to get things back up to level. Really, like I said, it kind of it's like opening the curtains up. It's like opening the curtains up and it's sunny outside and you're like, I'm going to go outside. And then you get outside and you're like, I know what to do next. It's just that first step of moving yourself in the right direction. And I'm as guilty of it. I'm just sharing all this because I have been through the ringer this past summer for whatever reason. And that pain loop that I was trapped in, and it's still there a little bit, but man, it really was an alarm that something was wrong. Mm-hmm. I was so succumbed by it. And I thought, man, something is off. Something is really off here. I've got to change course drastically, or I'm not going to get the leg up. And I'm glad to hear that part of that antisocial tendency is due to this. Because I'm like, what's wrong with me? I used to be so social. And now I'm like, I don't want to go anywhere. I don't want to see anyone.
Well, I think that's where physiology drives behavior, and then we can use behavior to drive physiology too. Yeah. So it's like when you got up and danced, you were self-medicating.
Yeah, totally.
You look at it that way, and that's beautiful. And men and women receive oxytocin differently too, and it's an important understanding for, especially during sexual intimacy. I work with a lot of couples for sexual health, and I teach in my program, Sexual CPR, the number one secret men need to know about women if they want to have them initiate sex more and be more receptive to sex. It's that the effects of oxytocin. So for women, it creates intimacy. But with a guy, I remember a couple, they were in their mid-30s, and he's like, she has great orgasms, but she never initiates sex. And I was like, well, what do you do after sex? And he's like, well, thinks about it for a second. And he's like, I roll over and go to sleep. I'm like, the benefits of oxytocin on men, the effects of oxytocin on men. I'm like, well, let's just do an experiment for 2 minutes. Give her 2 minutes, the amount of time it would take you to, lace your shoes, brush your teeth, shave. Give her 2 minutes to like just really be in that moment, that oxytocin bubble, and share what you like about each other, what you loved about the experience, what, just your plans and just share with her for 2 minutes, and let's see what that does. And it totally shifted her response too. Like she goes, I was surprised. I knew I needed something more, but I was really surprised, and I'm initiating sex now. And so that, like, just that little shift of just understanding those physiologic differences and then being able to voice what we need, really opens a whole nother level of healing, bonding, emotional capacity that we were missing.
Yes. Yeah. I mean, it might just be spooning silently for a few minutes and letting her, her bathe in that oxytocin. I will note that men, listening to your wives or your partners talk, even if she's rambling, that's foreplay.
That is foreplay, right?
That's a big one. Like just listening. And my husband is so smart. He'll say, do you want me to respond, or do you just need to be heard? And I'm like, I just need you to listen. I just need to off gas this. And then my cortisol comes down and my stress goes down, and I'm much more primed to go. And it's, and then just spooning, just a few minutes of cuddles, just rubbing her back. My foreplay is literally having my back rubbed. Like that's it. I just lay on his chest and he rubs my back sweetly, not in any kind of sexual way, just sweetly rubs my back. And that gets me going. Yeah. And it like, that's oxytocin.
Yep, absolutely. And I want to go back to like when you were talking about when your husband, like if he says something critical, and I look at it as, are you throwing cortisol at me? Or are you throwing oxytocin at me? Are you throwing cortisol, or are you throwing this at me for a fight? Or you're throwing to hold space, trust, and respect each other? So like cortisol versus oxytocin, I think of it as a dial, like those diagrams, like those half circle diagrams, and straight up and down being neutral, one side being cortisol, fear, hate, anger, distrust, and one side being oxytocin, love, respect, trust, that emotional capacity. Like, where is my dial in this conversation? How can I, take a deep breath, stimulate my vagus nerve, get out of my sympathetic into my parasympathetic, and hold space for this conversation in a respectful way. Maybe it might not be right at that time. It may be like, give me an hour a day and I'll come back and have this conversation. But, like to hold these, to really be aware of what we're doing to ourselves and the other person when if we're throwing cortisol versus oxytocin.
And then withholding oxytocin, even just silently withholding oxytocin from people. Like my husband, full disclosure, if we don't have intimacy and intercourse like once every 2 days we can't go more than 2 days. Otherwise he gets unruly and he gets very difficult to deal with. He also needs a lot of outside time. He's a farmer, so he needs a lot of outside time. He needs to get dirty and work hard and he's like a kid. If he doesn't come home like dirty and worn out at the end of the day, he's harder to deal with. But when he just starts making no sense to me, I just grab his hand and take him into the bedroom. And he's good for like 2-3 days after that.
That oxytocin. He needs that oxytocin.
It's incredible. Like he doesn't become docile. He just gets so much more manageable. He's like the Tasmanian devil otherwise. And all of a sudden he just gets really manageable. And I'm like, this is amazing. So ladies, like don't, underestimate the value. Like we get it different ways. I'm just trying to back up what you said there is we get it. Men and women receive it, make it with different stimuli. So
yeah.
That's funny.
So true. I was thinking my ex, it was every 3 days. So you could get unruly. I'm like, okay, yep, time's up.
Yeah. And it's just, my life is a million times easier. So it's not a big deal. And then I get my back rubbed. So, which is a big part of it, right?
Like and you get your oxytocin boost too. So it's,
Oh, go
tell
ahead.
women too, and when it comes to intimacy and sexual health and that reigniting that pattern, it's like your pleasure, speaking up for what you like. And the first secret I teach women is that, do you know what his number one turn on is? What's the number one thing that turns on guys when they with intimacy with their partner?
When she's turned on.
Exactly. Exactly. 100% it's her turn on. And I want every woman listening to hear that, because it's for you. Your pleasure is his pleasure, and that your partner's pleasure. And that's a physiologic boost versus our mirror neuron saying, I don't want him to see the side. I have too many roles here. I'm not comfortable with this. I don't want to be here. In our head, I'm making, and this is myself, past history, making my grocery list, carpool list, to-do list, all those things in your head. They're mere neurons. And so, what are you transmitting? So just to be in your body, and that training, that exercise of being in your body, in the bedroom, outside the bedroom, what brings you pleasure in the bedroom, outside the bedroom, are ways to improve your physiology, your health, your longevity.
Yes. Yes. And I know alcohol is not good for us, but sometimes a glass of wine can help you get there. Whatever it is, if it's, I have been through periods where I was just like so stressed out that I had no interest in intercourse at all. And a little bit of, well, it's kind of like when you give a breastfeeding mom a little bit of beer and the hops calms her and her breast milk lets down. It's like that kind of thing where it's just like maybe it's beer, maybe just a little bit of something. I'm not promoting alcohol, but you know what I'm saying? Like if you got to get it, sometimes it's a gummy. Whatever works, but like whatever gets your cortisol to come down so that you can go have some intimacy and stay present in those. I'm the same. I'll start checking out mentally, and I'll start like twiddling my hair and thinking about something. And then I'm like, no, come back to my body, because it's too easy to disassociate out of your body when you're stressed out. You got to come back in, and you got to be sometimes I'll just focus on like smelling, like what do I smell? What do I feel? What am I looking at? Like making intimacy an event that's healing, that's that I come out of it with better than I went in, kind of thing.
Completely. It was a client in my sexual CPR program. We had a live Q&A recently, and it was a 72-year-old woman, and she said, she had found that glass of wine and that CBD gummy is all she needs for receptivity. That's it. It was like her perfect thing. I'm like, who am I to judge, right?
No, man, the gummies, you never know. And I like anything that I can just break up into something smaller, So it's all dose dependent. It's, so it's like whatever just kind of, and I don't know, maybe it's just maybe we need to do maybe it's using a little oxytocin. It's just whatever it takes to get that cortisol to come to that place where I can like engage. It took a drink to get out on that dance floor, but once I got out there, the bliss just started blowing out of my head. So, whatever. Alcohol's not good for you folks. Okay, so since we're talking about sex, let's talk about vaginal health and transition there, because you have such a great take on this, and I agree with you wholeheartedly. I, by the way, learned so much from you every time I listen to you, talk to you. I watch your lectures everywhere I can find them. I just recently was pleasantly surprised. I bought the Harvard Women's Conference recently, and the first lecture was you. And I was like, yes. So you made a great case for this there.
Thank you.
Yeah.
Well, I think we talk about, want our health span to equal our lifespan. What about our sex span? And I think vaginal health is essential for life. Now, I'm a gynecologist, and my perspective is a little skewed, but I'm a gynecologist and a woman, and I've suffered with problems. And let me tell you, when the vagina is not healthy or the vulvar-vaginal area is not healthy, I mean, just think a yeast infection or a bladder infection. Life is miserable. And we don't want to deal with it in our 20s, 30s, 40s, 50s. Now I'm 59, let alone when I'm 60, 70, 80 or beyond. Like that is not the time. So an ounce of prevention is worth a pound of cure. And vaginal health is so important to overall health. And I will argue, Dr. Tina, that I consider vaginal health even as important as, or if not more important than dental health, and gynecologists preferred over dentist.
Heck yeah. 1,000%. Yes, 1,000%. I can do without my teeth. I've had my vagina go south on me. It's not fun.
Yeah.
I'll preface this. So I had atrophic vaginitis when I was I was in school. I was doing both programs concurrently. I had a little girl at home. I was in a horrific marriage that I needed to get out of. And my vagina just shriveled up and left the scene. It was gone. And then I got cytolytic vaginitis, which is essentially, you probably could explain this better, but the way I understand it is it was basically an overgrowth of my natural lactobacilli. Everything became very acidic and painful down there. And my vagina completely rejected my husband. And I have seen this with patient after patient, because you know me, I'm a straight shooter with patients. I'm like, when I can't get somebody out of a pain cycle, sometimes I have to ask them the hard questions, like, how much do you hate your job? Do you hate your spouse? Like, what do we do? What are we dealing with here at home? Like, what's driving this cortisol train that's driving the pain? And I can't tell you how many, and you've probably seen more of this as a gynecologist, women and men separate, and all of a sudden 99% of her vaginal issues disappear. And it's not just because his flora is off or they're not synchronizing. It's like, it was a mismatch. And now they have a happy vagina. So I went through a divorce. It was terrible and traumatizing, but my vagina came out the other side very happy. All of my issues disappeared. The flower came back, it had shriveled to nothing. I was 33 and I had complete atrophy. Like, it was horrific. And the flora balanced itself out. Everything got great. And I can happily say it's been great ever since. I do use a little topical, different hormones here and there, which maybe we'll get into, but I wholeheartedly have had my vagina check out on me. And it was hell. It was hell. And I had no joy in my life because of it. So I'm with you. Save the vagina.
Right. Save the vagina. Thank you. Thank you. I say the vagina is essential for life. I made everyone at that Harvard conference say it too.
Yes.
So, but it is so true. And and also what you experience, if the upper lips aren't talking, neither will the lower lips. Right. So like if, our body can't separate the head from the body, right? We're all connected. And that affects, like when we're under high stress, that affects our immune system. When we're traumatized, that affects our immune system. That's going to affect our microbiome all throughout our body. And that includes the vagina. And stress hormone, like what happens is it plummets our progesterone and pregnenolone gets suppressed. And that's like, these are hormones of life and nourishment and rebuilding. And it's not just a hormone of pregnancy, and it's not just a exogenous hormone to give if you have a uterus. Like, with or without a uterus, we need, make sure we've optimized our progesterone and pregnenolone levels. I mean, it's critically important and not talked about enough. And so when it comes to vaginal health and all of these, all these issues from atrophic vaginitis to vulvodynia or lichen sclerosus, urinary tract infections, incontinence issues, anal fissures, hemorrhoids. I mean, clitoris to anus, honestly, most important real estate of our body. Let's keep it healthy. Committing now on this podcast to focusing on vaginal health forever more. So we want to look at that. And also as the changes with time, because of hormonal changes with time, we lose the elasticity, muscular growth and capacity, the elasticity in the folds and the glandular secretions of the vagina. If anyone's experienced dry eyes, dry vagina is like basically the same reason, loss of those glandular secretions. And those glands are in the vulvar vestibule, or the vaginal vestibule, the opening, you're just outside the opening of the vagina. It's rich in these glands, which will atrophy at time, decreasing your natural secretions, which contribute to an acidic vaginal pH is what we want. It makes sense for the vagina to be acidic. This is an opening to our womb, to our body, right? This is an opening. So we want an acidic pH to kill off bacteria, parasites, viruses, etc. And so it makes sense that it's that way, but it's also because of the healthy hormones and secretions that our vaginas releasing and the vulvar vestibules releasing these glands. Bartholin's glands are key. And this relates directly to the microbiome of the vagina. So the bacteria, the healthy bacteria of the vagina, which I always tell a client, I can tell your overall health by the health of your vagina for sure, right? But when we think of the gut microbiome, we want that high diversity. But when it comes to the vaginal microbiome, we really see healthy being a predominant lactobacillus species. But as the vaginal pH starts to creep up, become more alkaline, we get associated with more urinary tract infections, bacterial vaginosis, a fishy odor, malodorous discharge, and an increase in the diversity of our gut bacteria, of our vaginal bacteria, which also contributes to overgrowth of HPV. We see an increase in HPV with the higher alkalinity and the more diverse vaginal microbiome. So like to tell a woman, we don't even need to do a pap smear or look in your vagina after a certain age or after menopause. It is not good medicine. It is malpractice, in my opinion. And, being able now to test for healthy vaginal bacteria is key. There's labs that are looking at the vaginal microbiome and being able to give probiotics for the vagina. I'm coming out with one soon that is specifically designed with these strains that are potent for vaginal health and restoring that hormonal balance to the vagina so your body's naturally increasing these glandular secretions again. And of course, like till we die, pelvic floor exercises, always do those till we die.
Yes. I am a big fan of Pilates and kettlebell swings because they really force you to pull that part of your cylinder up and in and keep it active and strong. And half the reason I strength train, half the reason I exercise is so that I have a really healthy pelvic floor. Like having a healthy vagina matters a lot. And the healthier, it's funny, when I got into Pilates, I was coming out of a really bad back injury. And my Pilates instructor at the time, she said, watch out, you're going to really start seeking out intimacy with your husband. Like things are going to turn on. And lo and behold, like you get good pelvic floor integrity through movement and suddenly the vagina wakes up.
It's a turn on.
It's all together. It all works together. And then you're so right. Like having good integrity down there, good tissue integrity. I had a blip of time. So like I said, my background was in all regenerative injection therapies. And I happened to have a patient come in who had lichen sclerosus, and I was doing stem cell procedures for musculoskeletal complaints. And she said, can you put stem cells in my vagina? Because I heard about this potentially being helpful. And I said, sure. And she was a naturopathic doctor, so she was really healthy and she knew about her gut health and all of that. I think looking back, she desperately needed, she's very lean. I think she desperately needed some HRT, but wouldn't hear it. And, we treated her, and whether it was PRP, platelet-rich plasma, or stem cells with PRP, both were effective. And then I started getting this whole following of people coming in from all over the world. And in most cases of lichen sclerosus, there was severe GI dysfunction and severe bacterial overgrowth. Like I would see a lot of candida, a lot of IBS, a lot of IBD, just all kinds of stuff. But also there was a significant amount of trauma in their history, like emotional trauma. And in most cases, these women had been abused in some capacity. And it was pretty awful to hear their stories because it was heartbreaking, but their vagina was responding in turn. And it was very interesting. There would be some kind of like sexual assault in their teens. And then years later, when they hit menopause, their lichen sclerosus would show itself. And anywho, I got out of that because I didn't love it. It was a very difficult population to treat. There's a lot more to lichen sclerosus than the lichen sclerosus. There's, as you well know, there's just a whole integrative approach that needed to occur that I couldn't always do with long distance patients. And all that to say, once it starts going, it really starts going. And a lot of times it would start with something as simple as what you're describing, like menopause or some atrophy from stress, or, it was just this feed forward mechanism into suddenly a place that was very difficult to get out of. So I'm a big fan of, like you said, I think that it's really a sign of vitality, a happy, healthy vagina and breasts with good heft and good tissue integrity mean a lot as far as what your overall health is doing.
I think that, I have a patient, I think about her right now. She's now 67. She's been, she's been using one of my products, my Julva product, which is topical DHEA and plant stem cells for since 2016. She was the first one in my practice. And she, a couple of years ago, she called me. She goes, Dr. Anna, my gynecologist says I have the vagina of a 25-year-old. I'm like, well, there's no better marker of aging than that, let me tell you. And another thing, when she was 64, she got married. She had been widowed for 20 something years, and she got remarried, and their sex life is good. And she goes, I attribute this to the health of my vagina and what we've been doing together, because it's made an entire difference in my life, my intimacy, my relationship with my husband. I mean, it just made a huge difference. And I think we underestimate that. We think, oh, well, that's just the superficial. It is not.
No.
It is deeply meaningful and essential and designed like the clitoris. Well, what else is it designed for but our pleasure? We not want that to atrophy. We have to keep that healthy. And using topical DHEA on that area makes a huge difference in that sensitivity, blood flow, and that pleasure marker. So
absolutely. You gave me some Jolva and I use it. I keep it in my drawer, and I put on all my face stuff at night after I take my shower, and then I use my Jolva down there. Actually, I use it on my lips too, my lips up here. I use it on both my lips. And then I used it actually per your recommendation. I couldn't get my eyes to heal after my upper bleph. So I started using it there and it worked great. So it's a great product. I highly recommend people check it out. Why is it important? This is the conversation I wanted to end with, is why is it important that we consider more than just estradiol or estriol for the vagina?
So this is the thing we know. We know studies way back into the 90s that vaginal estrogen is safe and effective, and including in women. There was a study published in early 2000s that looked at a 12-year retrospective history of women with breast cancer and vaginal estrogen. And we could say, okay, vaginal estrogen is safe. But early on in 1999, I had a patient come in who was 63, had a history of a diagnosis of DCIS, and had lost all her sex drive, had atrophic vaginitis. And she came into me and she was quite intimidating. She was a CEO of a biotech firm. And here I am, a Southern Georgia solo physician, right? And she's like, Dr. Anna, I'm a woman of the 60s. My sex life is very important to me. I feel like I'm dead down there. It hurts when we try to have sex, and I'd rather die than live this way. Help me. And I took that really seriously. So beyond estrogen, what could I do to really replenish and rebuild? Because if estrogen only works on the mucosa to help with that superficial moisture, what could I do deeper down? And because she was a CEO of a biotech firm and a scientist, we researched together DHEA, testosterone, what are the safety, even in breast cancer, even though she had DCIS, not breast cancer. And so we looked at this together, and I put her on testosterone and DHEA. Did some time for some period of time with troches, and then topically, transdermally to the vulvar vaginal area, because it's the external area of the vagina we don't talk about, but we think of vaginal estrogen. But what is that doing for the clitoris? What's that doing for the vulva that is rich in blood vessels and nerves and very sensitive? How is that helping the anal tissue, decreasing your risk of hemorrhoids and anal fissures? So using that topically, clitoris to anus, made all the difference in her life. And the other thing with her, because she was 63 when I first saw her, I did a bone density scan, repeated it 10 years later. And her bones were, the same as they were 10 years prior, which you would expect at 73 to have lost some bone, being postmenopausal and not on oral estrogen therapy or anything else. And perfectly. And then I saw her 19 years after I'd started working with her, and she was on crutches. I was like, oh my gosh, what happened? Did you fracture? What happened to your bone? She goes, no, I was skiing the black slopes. I'm good. I'm like, okay, that's what we want to do. At 82, she wrote her memoirs. So I've been able to follow my patients over time at different ages and see the health and benefit, like restoring your vaginal vulvar health, sexual vitality, bladder health makes all the difference. The other thing that we don't talk enough about, and it's certainly not on social media, but urinary tract infections, the asymptomatic and the symptomatic urinary tract infections. And in menopause and beyond, that becomes a real issue, increasing incontinence, causing cystitis, causing bladder frequency, decreasing your quality of life. But if we keep the urethral tissue, so the opening to the urethra and the urethral tissue, just like we keep the health of the vagina and the opening to the vagina and the vulvar tissue healthy, and with, of course, pelvic floor exercises, we reduce that incidence of urinary tract infections, preventing it. I had a girlfriend whose mother was a stroke patient, and she was bedridden, but was on, antibiotics regularly. I said, start using Jolva and just just have her wipe it on or have, and do that daily. And she didn't have another urinary tract infection. So there's something to improving the health of our microbiome that works to help defend us from these things that we, think, oh, it's expected at our age to have incontinence, or it's expected to, have, to run to the bladder. I'm like, no, it's not. We can do something about it. And urinary tract infections or incontinence is the reason women, get up in the middle of the night, fall and break a hip, right?
Yes.
On their way to the bathroom.
Yes.
And that's the straw that breaks the caregiver's back when there's incontinence involved. And I have 4 daughters. Tina, you know this. You've met a few of them.
You have 4
I don't want to give them any reason.
You have beautiful girls. You have a whole gaggle of beautiful girls.
Oh my God, they are. And I'm like, I don't want to give them any reason to tuck me away in a nursing home. So I'm keeping my bladder, vaginal health, and urethral health, all of the above, clitoris to anus, healthy, quality of life, and keep my brain right there with it.
It's a big deal.
Oxytocin boosts the brain. So
Yep. No, it's a big deal. I have seen chronic UTIs in young women, right? As I'm sure you've seen plenty of. And our first gumption is like, oh, they must have changed sexual partners, and maybe they're not wiping from front to back, or what is it? And these are women in their 20s and 30s. And often I started paying attention. Often they had just gone through significant weight loss. They often were very, very lean or underweight. And I was like, oh, you're just missing estrogen, period, and hormones, period, because you don't have enough body fat at all. And then the other group I saw treated a lot of folks in their 80s for joint issues. And I would, this was terrible how often I saw this. I would often see patients that I knew very well, that I had been with, they'd been with me for years. They'd been with my mentor for decades. I knew these people, and I would watch them start to get low-key dementia, but it would always coincide with low-key chronic UTIs.
Absolutely.
And they were often asymptomatic UTIs. And so I would test them, because I'm certainly not going to put a needle in their joint if they have an infection in their body. So I would have them do a urinary dipstick in the office, and it always came back with leukocytes. And I just started seeing this correlation of like asymptomatic UTIs, low key, and their families like, I think they're going crazy. We have to put them in a home. They're losing their marbles. I'm like, I think they just need some hormones on their hoo-ha to start. Like, we need to start there. This is important.
Completely. And yeah, not to underestimate that, even asymptomatic UTIs can cause neurologic symptoms.
Yeah.
And can be mistakenly diagnosed as dementia. You clear that up, all the ways we do functional medicine perspective, and, then they're sharper than ever.
And the testosterone, the DHEA topically down there, something my mentor taught me a long time ago to use. And in fact, I will often reach for that before I go to an estrogen down there.
Too.
So, because like you have said, and I've learned from you as well, is that we have to keep the muscular integrity. Like, we're treating deeper than just that superficial layer of mucosa. So I'm excited about the idea that this is getting some play, and we're seeing a lot of talk about it on social media, but there's more to it, right? And Julva's available over the counter. So there's that.
And it's a clean formula. Again, use it clitoris to anus, use it on the vaginal orifice. And the other thing too, DHEA is one of the key ingredients in it with the plant stem cells, but it's safe for men, and they can use 5 times the amount. I used to say 10 times the amount, but I did have a colleague who's a chiropractor use a full packet of my 7-day sample of Julva. And he's like, 4 hours later, he was like, do I need to go to the emergency room? I still have an erection. I'm like, you used the whole packet? I mean, what were you thinking? I was like, I thought I could use.
You bring up an important point, though. This is one of the reasons I like DHEA and or testosterone for women topically, vaginally, because a lot of my patients are athletic, they're fit, they're healthy, they have very healthy sex lives. And one of the big concerns with topical estrogen is, are you going to get it on your partner? So you put it on at night and you hope for the best in the morning, but I want to put testosterone on him or DHEA on him. I want to put something that he needs more, that's going to be a little bit better for him. So I like the idea of, and you can get there in all different ways. I've used all 3 hormones down there, and you can, I put progesterone up there sometimes.
Yep.
I will say this, and I just wanted to know your thoughts. I have women who, when I'm using topical testosterone, and we're not getting levels up in the blood, I will have them switch from forearms or legs, wherever they're putting it, usually legs, I would say, to vaginal, because the mucosa of the vagina is so absorbent. And so we have to consider that. And I'm not saying that to dissuade anyone. It's actually a bonus. Like, we can use the vaginal tissue to uptake the things. And so this leads me to that study of topical or vaginal estrogen being safe for breast cancer patients. It kind of makes you wonder, like, is estrogen safer? Because we are getting we have studies, we're getting systemic levels in the blood increased when we use topical down there of any hormone.
Yeah. Yeah. So DHA and testosterone's preference. And I always my patients know, like, if you're going to use a testosterone topical, like, do not waste it on your inner arms or your legs. Like, do not waste it there.
Thank you.
Clitoris, vulva, external tissue, mons pubis. I mean, vaginal. I mean, this is good. This is a good space. And if you get a little extra hair growth there, it's okay.
Yes, thank you.
It'll be an easier Brazilian wax since you've been using it there.
I love it. Perfect place to close. I love you, Anna. Tell everyone where to find you, because you're such a wealth of information, and I just want everyone to know more about you.
Thank you. Easy to find me at drtana.com. So DRANNA.com. I have my show. Dr. Tina's been on my show at dranna.com/show, or anywhere you listen to podcasts, and on social media at The Girlfriend Doctor. And thanks so much for having me. Oh, I did want to shout out, though, because we talk so much about oxytocin. I created an oxytocin quiz. Like, if we were to test someone, do you need oxytocin? You want a good questionnaire. You want a good physical exam, plus or minus a blood test. They're really challenging. But this quiz, and sometimes you do a challenge test with a intramuscular dose of oxytocin. Those are some things that you can do medically as physicians to estimate, does a person need it? But the quiz can give us a really good idea and can give you a baseline. So I do have a very quick, short, oxytocin quiz on my website too. If you're like, I wonder if I am low in oxytocin, can ask yourself those questions.
Yeah, it's a great resource. I checked it out, and it's great for clinicians as well who are just getting into this and learning about this for the first time. Go check out that resource because it's beautiful. And you do such a good job of showing folks once they're in your world of all the different offerings that you have, because there's books, there's all kinds of good stuff in the Dr. Anna world. So
I say mess becomes your message. That's it.
Yes. All right. Well, thank you so much for being on. Love you so much. And thank you for sharing your knowledge with us.
Thank you for having me.
Thanks for listening to the Dr. Tina Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guilt. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.